Malocclusion of the teeth. What is malocclusion? What causes malocclusion? Symptom of malocclusion: crowded teeth, excessive overbite, excessive overjet, crossbite, underbite, open bite, diastema. Malocclusion complication. What is malocclusion? Malocclusion is the medical term for a bad bite where someone's teeth are misaligned and don't make proper contact. There may be an underlying issue with this upper or lower jaw. With an ideal bite, the top and bottom teeth fit well together when your mouth is closed. The back of your top front teeth should sit gently in front of your bottom front teeth. Many people have very fine degree of malocclusion. Their teeth don't quite fit together in an ideal way. Depending on the type of severity of the malocclusion, health problem can result including sleep apnea and gum disease. What causes malocclusion? Malocclusion including overbite, underbite and several other conditions. There are multiple possible causes of malocclusion and they may overlap. Genetic factors, jaw shape and size are partly inherited and some people are predisposed to develop misaligned teeth. Diet: an excessively soft diet or a diet low in vitamins such as vitamin K can contribute to a weaker jaw and misaligned teeth. Childhood habit: thumb sucking, mouth breathing and tongue twisting are all habits that can affect tooth and jaw development over time. Injury or illness, fracture, dislocation and disease that affect the jaw or teeth can all contribute to misalignment. Whatever the underlying cause, orthodontic treatment and surgery can generally correct this issue, creating or restoring a perfect bite. Symptom of malocclusion. The symptoms of malocclusion are usually obvious, but some are subtle and may include crowded or crooked teeth, altered facial appearance, jaw or teeth discomfort when bite and chewing, mouth breathing, a lips or other speech problem, biting your cheek, tongue or lips, often lips that don't closely fully. Classification of malocclusion. Click on the top bottom to watch this video. Crowded teeth. Dental crowding occurs when there isn't enough space in this mouth for the permanent teeth to grow in stage. Crowding often only affects the front teeth, making it a class 1 malocclusion. Crowding can be caused by a person's jaw not being big enough to fit all of their teeth properly, or by alignment issue from when they first lost their baby teeth. Excessive overbite. An excessive overbite is a class 2 malocclusion where these upper teeth are too far forward compared to the lower teeth. When a person's mouth is closed, the top front teeth come stage down, but they cover more of the bottom teeth than they should. An excessive overbite should be treated as soon as possible. If left untreated, breathing problem, jaw disorder and oral health issue can develop. Excessive overjet. An excessive overjet is a class 2 malocclusion similar to an excessive overbite. The difference between an excessive overbite and an excessive overjet is that an overjet is horizontal rather than vertical. The top front teeth protruded at an angle and don't make contact with the bottom front teeth. Excessive overjet are often caused by thumb sucking or tongue twisting in childhood. Untreated excess overjet can result in temporomandibular joint disorder. Crossbite. A crossbite is a class 2 malocclusion that occurs when a few bottom teeth are located outside the upper teeth when this mouth is closed. Genetics, mouth breathing, delay, permanent teeth eruption and childhood habits, that is thumb sucking, can cause this malocclusion. A crossbite may involve this front teeth, anterior crossbite, with one or more lower teeth coming out in front of these upper teeth. This can look like a partial underbite. An underbite can also occur together with a crossbite. So all these bottom teeth, front and back, or outside this top teeth. Underbite. An underbite is a class 3 malocclusion that occurs when these lower teeth are in front of the lower teeth. If an underbite is a skeletal, the bone of this jaw are involved. Either the lower jaw is overdeveloped or this upper jaw is underdeveloped. Some underbites are dental and only affect the teeth. They may occur together with a crossbite. Like an overbite and underbite should be treated as early as possible to prevent health problems. Open bite. An open bite is the rarest form of malocclusion. It occurs when the upper and lower teeth slant outward and do not touch when the mouth is closed. An open bite can affect the front or back teeth. The condition may be caused by genetic factor or teeth that don't erupt properly. Habits like thumb sucking can also cause a open bite. Undertreated open bite typically result in speaking problem as well as issue treating and chewing food. Diastema, gap teeth. Diastema is when there is a space or gap between two or more teeth. Gaps can range in size, with some being barely noticeable and others being more prominent. A midline diastema, which appears as a gap between these two upper front teeth, is most common form of diastema. Malocclusion complication. A mild malocclusion may not cause health problem, especially if it doesn't involve jaw misalignment. However, it may pose a cosmetic issue affecting a person's self-image and social life. On the other hand, malocclusion may involve severe dental crowding and jaw alignment issue. In case like this, early treatment can prevent future complications such as breathing problem, including sleep apnea, when can be life-threatening. Periodontal disease, which can eventually lead to bone and tooth loss. Temporomandibular joint disorder, which affect the jaw joint. Tooth decay. Long-term damage to tooth enamel. Difficulty eating and speaking. Oral hygiene difficulties, which can lead to some of these above.